The higher case count should not come as a surprise since more people are getting tested for the disease. That's as more testing sites are opening around San Antonio, including one today and another tomorrow. The goal, to reduce the long wait times we've been seeing. Tonight, more Americans are in the hospital with COVID than ever before. Pandemic forecasters at the University of Texas predicted this would happen. Now they say San Antonio could smash its own record in just 2 weeks. Eyewitness News reporter Matt Houston explains what that means for you.
As more nurses catch the virus, hospitals are desperate for extra staff. And Texas is out of one of its best COVID-19 treatments. But scientists say things can and will get worse.
This suggests that hospital admissions will keep rising in the next few days.
Anash Bushnita is one of UT's top researchers. Their short-term models indicate Texas could more than double its hospitalization record by early February. Bexar County would reach a record 2,000 patients at around the same time.
We should really not underestimate Omicron, and even if it's turned out to be a mild variant, then it has the ability to overwhelm the healthcare capacity.
So far, a smaller portion of people infected with Omicron need the hospital compared to previous strains. But so many have the virus now that the total number of COVID-19 patients is higher. Still, local doctors are optimistic.
I think the end of this pandemic is in sight.
UT's long-term models say there's a good chance the U.S. will not break its record for deaths. And today, the CDC endorsed a study indicating Omicron is almost 75% less likely to put someone in the ICU than Delta.
Matt joins us from the medical center. Matt, are people with Omicron spending as much time in the hospital when they check in?
Yeah, Sharon, that same CDC study indicates Omicron keeps someone in the hospital for a smaller amount of time. And this is something, frankly, that we have seen lately in Bexar County with the daily number of checkouts. In fact, keep this in mind, we know that more people who are going to the hospital than ever before are testing positive for after they've gone to the hospital for something unrelated to COVID, like a broken leg or something of that nature. So that sort of adds to the numbers. The biggest issue here, though, is that even with a higher number of checkouts, if 100 people enter the hospital and leave the next day, 125 might replace them the day after that. It's a net gain, and we've already told you here that nurses, they're stressed, they're overworked, and hospitals are understaffed. I'm Matt Houston, KINS 5, Eyewitness News.